Prednisolone sodium phosphate drops are used to treat certain eye conditions caused by inflammation or injury. These drops work by relieving symptoms such as swelling, redness, and itching. They belong to a class of drugs known as corticosteroids. The usual dosage is 1 to 2 drops in the affected eyes 4 times a day. It is best to use them at evenly spaced intervals throughout the day. Be sure to follow the dosage instructions provided by your doctor. When using prednisolone sodium phosphate drops, it's important to follow some specific instructions to ensure the effectiveness of the medication and to avoid any potential complications. First, if your doctor approves the use of contact lenses while using this medication, be sure to remove the lenses before applying the eye drops. The preservative in this product may be absorbed by contact lenses, so it's important to wait at least 15 minutes after each dose before wearing the lenses again. To apply the eye drops, wash your hands first, and if you are using a suspension form of this medication, shake the bottle well before using. When applying the drops, tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place 1 drop into the pouch. Try not to blink and do not rub your eye. If your doctor has prescribed more than 1 drop, repeat these steps for your other eye. It's important to use this medication regularly in order to get the most benefit from it. To help you remember, use it at the same times each day. The dosage and length of treatment are based on your medical condition and response to treatment. Do not use this medication more often or for longer than prescribed because doing so may increase your risk of side effects. If your condition does not improve after 2 days or if it worsens, be sure to contact your doctor. And as always, do not stop using this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. When using prednisolone sodium phosphate drops, you may experience a brief stinging or burning sensation in your eyes. If this persists or worsens, it's important to inform your doctor or pharmacist. It's essential to note that this medication has been prescribed to you because its benefits outweigh the risk of potential side effects. While many people do not experience serious side effects, prolonged or high-dose use of this medication can lead to significant eye issues such as high pressure inside the eyes and cataracts. If you notice any vision problems or eye pain, it's crucial to seek medical attention immediately. Additionally, prednisolone sodium phosphate drops may mask the signs of an eye infection and increase your risk of developing one, especially with prolonged use. If you experience any new or worsening symptoms such as eye discharge, swelling, redness, or vision problems, it's important to report them to your doctor. They may need to adjust your treatment accordingly. While serious allergic reactions to this medication are rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you experience any other effects not mentioned here, it's best to contact your doctor or pharmacist for further guidance. Before using prednisolone, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have had eye infections, recent eye surgery, cataracts, glaucoma, severe nearsightedness, or diabetes. After using the drops, your vision may become temporarily blurry or unstable, so it's important not to drive or use machinery until your vision has cleared. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you develop a new eye infection or injury, or if you need to have eye surgery, consult your doctor about whether you should continue using the prednisolone drops from your current bottle or start a new one. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also unknown whether this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware that prednisolone sodium phosphate drops may interact with other medications, which could impact how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of prednisolone sodium phosphate drops. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help. In the U.S., the local poison control center can be reached at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. Do not give this medication to anyone else. This medication has been prescribed specifically for your current condition. Do not use it for another eye condition unless instructed to do so by your doctor. You may need a different medication for a different condition. You may need to undergo lab tests or medical exams while using this medication, such as eye exams or measurement of the pressure inside your eyes. Make sure to attend all scheduled medical and lab appointments. If you have any questions, consult your doctor for more information. If you forget to take a dose of prednisolone sodium phosphate drops, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When storing prednisolone sodium phosphate drops, it's important to keep them at room temperature and away from light. Different brands may have different storage instructions, so be sure to check the product package or ask your pharmacist. Avoid freezing the drops and keep the bottle upright and tightly closed when not in use. It's also important to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the drops when they are expired or no longer needed, and you can consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.